Welcome to the training for healthcare professionals. Let's begin with the module on subcutaneous injections. Before we begin, let's look at the key learning objectives of this module. After completing this module, you will be able to identify sites for giving subcutaneous injections, administer subcutaneous injection to patients. What is a subcutaneous injection? A subcutaneous injection is one that is administered into the fatty layer of skin directly below the dermis and epidermis as shown in the image. Subcutaneous injections are highly effective in administering vaccines and medications such as insulin, morphine, diacetyl morphine. The subcutaneous injection should be given under the skin at one of the following sites: the abdominal area, just above or below the waist, leaving a 2-inch circular area around the navel. The front of the thigh, from midway to the outer side, that is, 4 inches below the top of the thigh to 4 inches above the knee. The outer area of the upper arm. The upper area of the buttock, just behind the hip bone. Subcutaneous injection is given when slow, sustained absorption of a medicine is prescribed, up to 3 milliliters, most often less than 0.5 milliliters. It is primarily recommended for patients who take frequent injections like insulin or type 1 diabetes. Here are the items we need for administering subcutaneous injection. 1. Syringe, 1 to 3 milliliter, calibrated in 0.1 milliliters. 2. Sterile needle according to the patient's size. 3. Prescribed medication. 4. Gauze pad or a Band-Aid. 5. Alcohol swab. 6. Gloves. 1. Wash your hands and gather supplies. 2. Provide for patient privacy. Explain the procedure to the patient and take their consent. 3. Select an injection site with no bruises, swelling, inflammation or scars. 4. Wear gloves. 5. Hold a dry gauze in your non-dominant hand and clean the site with antiseptic swab in a spiral motion and allow it to dry. 6. Remove the needle cap. Hold the syringe between your thumb and forefinger of the dominant hand. 7. Pick up the medication vial and hold it upside down, taking care not to touch the rubber stopper. Insert the needle into it. 8. Pull back the plunger slowly and gently until you have reached the desired dosage. Expel any air bubbles by gently pressing the plunger, forcing the air bubbles back into the medication vial. 9. Pinch the skin with the non-dominant hand. The skin has numerous pain receptors and the patient may experience discomfort during injection. So the purpose is also to find an area that is least painful. 10. Needle length and angle of insertions is based on the client's weight. If you can pinch 2 inches of skin, insert the needle at a 90-degree angle. Otherwise, insert it at a 45-degree angle. 11. Hold the needle in the hand as you would hold a pen. Push the plunger with the thumb while keeping the syringe between the index and middle fingers. 12. Depress the plunger with steady, even pressure until all of the medication has been injected. 13. Remove the needle quickly and place a dry gauze over the site with gentle pressure. Do not massage. 14. Discard the needle and syringe. 15. Remove gloves and wash hands. Post giving the injection, you need to assess for pain, burning, numbness or tingling at the injected site. Observe the response to the medication. Record the response to the medication. Now let us see a demonstration on administering subcutaneous injection to a patient. Note that the equipment, material and procedures used here could be different from those in your hospital setup. Understand the technique and then apply it in the context of your healthcare facility.
Wash your hands and observe standard precautions. Assess the need for medication, in this case, checking the blood sugar. Explain what you are doing and check the patient's ID.
Hi there, Elma. I need to take your blood sugar.
Okay.
Can you tell me your full name and date of birth?
Alma Jones, 2638.
Thank you, Elma. Elma, which finger would you like me to use?
Well, I think maybe the middle one, it's less sore.
All right, Elma. Okay, Elma, you're going to feel a small prick here.
Okay.
Your blood sugar is 154.
Oh.
I'll need to get you some insulin.
Confirm the insulin dose with the physician's orders and the MAR. Read the label 3 times. When it is taken from the medication cart, before withdrawing the medication, and after withdrawing the medication. Mix the solution by rolling the vial gently between your hands. When mixing insulin, always withdraw the regular insulin, which is clear, first to minimize the possibility of the regular insulin becoming contaminated with the additional protein in NPH, which is cloudy. Remember, clear before cloudy. Clean the tops of the vials with the antiseptic swab in circular motion. I'll use the example of mixing 10 units of regular insulin and 30 units of NPH. With the vial placed on a firm surface, insert the needle into the center of the rubber cap, maintaining sterility. Inject 30 units of air into the NPH vial and withdraw the needle. There should be no insulin in the needle, and the needle should not touch the insulin. Inject 10 units of air into the regular insulin vial and promptly withdraw 10 units of regular insulin. Reinsert the needle into the NPH vial and withdraw 30 units of NPH. Be careful to withdraw only the ordered amount. If excess medication has been withdrawn, discard the syringe and begin again with both insulins. Withdraw the needle and replace the cap over the needle using the scoop method to maintain sterility.
Hi there, Elma.
Recheck the
I have
patient's
your
ID and
insulin
create
here.
privacy.
I'd like you to please tell me your full name and date of birth.
Alma Jones, 2638.
Thank you. I'm just going to lower this side rail here.
Okay.
Great.
Wash your hands.
And I'm going to wash up my hands, and I'm going to need to have access to your arm here, so I'd like you to raise your arm up.
Okay. Is this the way you want me?
That's great, Elma. Thank you so much.
Yeah. When
Compare the MAR to the medication to be given. Wipe the injection site with alcohol swab and let the skin dry.
Great. We'll let that alcohol dry and I'll give you your injection in just a moment.
Okay.
Okay, Elma, I'd like you to take a nice deep breath for me.
Pinch the skin and insert
1,
the needle
2,
into the
3.
skin at an 80 to 90 degree angle and inject.
That's good. The needle's coming out now.
Discard
Okay,
the needle and
Elma,
syringe
we're all
into the
done
sharps
there.
container. As always, document that you
You're not
gave the
bleeding at all.
medication
You
on the
can just
MAR,
relax your
including
arm.
the injection
Okay.
site.
I'm going to let you get some rest and I'll come back and check on you in a little while. Call me if you need anything at all.
Okay, thank you.
You're welcome.
Always remember to complete your documentation after the procedure is done. Let's summarize some essential points to remember. Subcutaneous injections are relatively pain-free and suitable for frequent injections like insulin. The injection site should be changed frequently. Check the site for bruise, swelling, prevalent pain before administering subcutaneous injection. Check the 7 rights of medication before administering the injection. Do not aspirate or draw out the plunger when administering subcutaneous injection. Remember not to massage the site after administering the subcutaneous injection.